Hello, everyone. I hope that you are all enjoying the summit today. My name is Marnie Michalak, and I'm a nurse practitioner working for Wellness MD with a specific focus on lesion consultation and removal, skin rejuvenation, and IV therapies. Today, I would like to discuss the benefits of IV therapy during menopause. I'd like to start with a brief story. So, a woman in her early 50s came into the clinic and said something that I hear all the time. She said, I feel like my body changed overnight. I'm exhausted. I can't think clearly. I'm not sleeping well. And the things that used to work for my health just aren't working anymore. She wasn't sick. She wasn't doing anything wrong, but she was going through menopause. And for many women, menopause can feel like the body suddenly changed the rules. Menopause is often talked about in terms of hot flashes, but the reality is that menopause affects almost every system in the body. Hormones help to regulate energy production, sleep cycles, brain chemistry, hydration balance, and how our bodies use nutrients. When estrogen declines, those systems become less efficient. That's why women may experience fatigue, brain fog, mood shifts, and slower recovery from stress. So the question becomes, how do we support the body during this transition? Lifestyle strategies like nutrition, movement, and sleep are essential, but sometimes the body needs additional support to replenish what it's using faster than it can replace. This is where therapies like IV nutrient therapy come into the conversation. IV therapy is a clinical method of delivering fluids and nutrients directly into the bloodstream through a vein. What makes this approach unique is that it bypasses the digestive system entirely. When we take supplements orally, absorption can be limited by gut health, age, stress, and metabolic changes, which are all highly relevant during menopause. With IV therapy, nutrients are immediately available for the body to use at the cellular level. This allows us to deliver hydration, vitamins, minerals, and antioxidants more efficiently and in therapeutic doses. Another important aspect is customization. Formulations can be tailored to support specific concerns, so fatigue, brain fog, stress, or immune resilience, which many women experience during midlife. As we move through midlife, several nutrients become especially important. As we move through midlife and into menopause, the body's nutritional needs don't just stay the same, they often increase. B vitamins are essential for converting food into energy and supporting cognitive function, which becomes especially important when women are experiencing fatigue or brain fog. Magnesium is a key mineral for this stage of life. It supports the nervous system and helps to regulate the stress response and plays a direct role in sleep quality, something many women struggle with during menopause. Vitamin C and zinc are critical for immune function, tissue repair, and even skin health, which can be affected by declining estrogen levels. Amino acids are the building blocks for both muscle maintenance and neurotransmitters, so they support both physical strength and mood balance. And importantly, antioxidants help to counteract oxidative stress, which naturally increases with aging and hormonal shifts. When you layer in chronic stress, disrupted sleep, and changes in metabolism, the body can become more depleted, making target nutrient support not just helpful, but often necessary. Hydration is often overlooked, but it becomes significantly more important during menopause. As estrogen declines, the body's ability to regulate fluids and electrolytes can shift. Many women experience subtle chronic dehydration, which can show up as fatigue, headaches, dry skin, and even reduced cognitive clarity. IV therapy provides rapid, efficient hydration at a cellular level. This isn't just about fluids, it's about restoring electrolyte balance and improving circulation. Proper hydration also plays a key role in detoxification pathways, lymphatic flow, and nutrient transport. So when we improve hydration, we're often improving multiple systems at once, which is why many women report feeling better quite quickly after a session. Glutathione is one of the most important compounds to understand when we talk about detoxification and menopause. As hormonal shifts occur, the body's ability to process and clear hormones can become less efficient. This is where glutathione plays a central role. It supports the liver in processing not only hormones, but also environmental toxins and metabolic waste. It's also essential for cellular repair, which becomes increasingly important as we age. However, glutathione levels naturally decline over time, especially with stress, poor sleep, and toxin exposure, factors that are very common in midlife. When we support glutathione levels, we're not just targeting one symptom, we're supporting multiple systems at once. Glutathione helps to reduce oxidative stress, which tends to increase during menopause and contributes to aging and inflammation. It also plays a role in immune resilience, which can be impacted by stress and sleep disruption. Many women are also interested in the skin benefits. Glutathione supports detox pathways that can improve skin clarity and overall brightness. So the effects of glutathione are both internal and visible. NAD+ is another powerful compound that's gaining attention in menopause and longevity care. It's a coenzyme that plays a critical role in mitochondrial function, essentially how our cells produce energy. As we age, NAD+ levels naturally decline, and this is associated with fatigue, reduced cognitive clarity, and a slower cellular repair. This is why NAD+ is being explored as a way to support energy, focus, and overall cellular health during midlife. What's exciting is how glutathione and NAD+ work together. Glutathione supports detoxification and protects cells from damage, while NAD+ supports energy production and cellular repair. Together, they're not just addressing symptoms, they're supporting the underlying cellular processes that drive how we feel. This is why these therapies are becoming more popular in both menopause care and longevity-focused medicine. One of the most well-known IV therapies is the Myers cocktail. It's a foundational blend that includes B vitamins for energy, magnesium for relaxation and stress support, calcium, and vitamin C. This combination is often used to support overall wellness, energy levels, and nervous system balance. For many women, this serves as a great starting point before moving into more targeted or advanced IV therapies. Immune support becomes increasingly important during menopause. Hormonal changes combined with stress and disrupted sleep can weaken the immune resilience. IV formulations that include vitamin C, zinc, and antioxidants help to support the immune system. They reduce inflammation and improve recovery. This can be especially helpful during periods of stress, illness, or burnout. When we talk about anti-aging in this setting, we're really talking about optimizing how the body functions at a cellular level. IV therapy can support this by reducing oxidative stress, improving mitochondrial function, and enhancing cellular repair. For women, this often translates into real-life benefits, so better energy, clearer thinking, improved skin quality, and an overall sense of vitality. It's not about reversing age, but about supporting the body to function at its best during this stage of life. One of the most important things to understand is that IV therapy should never be a one-size-fits-all. Two women in menopause can have completely different experiences. So one may struggle with anxiety and insomnia, while another is dealing with fatigue and brain fog. That's why personalization is critical. Protocols should be based on symptoms, lifestyle factors like stress and nutrition, and ideally lab testing when available. This approach not only improves outcomes, but also ensures safety and avoids unnecessary supplementation. It's important to approach this topic with both optimism and realism. So IV therapy is not a cure for menopause, and it doesn't replace hormonal or medical care when needed. But what it can do is support how women feel on a daily basis. Many women do report improvements in energy, not necessarily a stimulant effect, but a more stable, sustained sense of energy throughout the day. Mental clarity is another common benefit. Brain fog is one of the most frustrating symptoms in midlife, and targeted nutrients that support neurotransmitters and mitochondrial function may help to improve focus and cognitive sharpness. Stress recovery is a key point here. It's not just about reducing stress, but improving how the body responds to it. Women often say they feel less overwhelmed and more resilient. Muscle relaxation and physical comfort can also improve, particularly with nutrients like magnesium, which supports the nervous system and can ease tension in the body. And then there's overall well-being, which is really harder to quantify, but it's incredibly important. It's that sense of feeling more balanced, more capable, and more like yourself again. Another subtle but meaningful shift some women notice is improved motivation, having the energy and clarity to re-engage with habits that support their health. Safety should always be the foundation of any discussion around IV therapy. This is a medical treatment, it's not a casual wellness trend, and it should be approached with the same level of care and oversight. A proper medical screening helps to identify any potential contraindications. So that would be kidney concerns, cardiovascular conditions, or interactions with medications that could affect how the body handles fluids and nutrients. Working with trained and licensed providers ensures not only safe administration, but also appropriate formulation and dosing. This is especially important because more is not always better when it comes to nutrients. Personalization also plays a role in minimizing risk. For example, a woman dealing with high stress and poor sleep may need a very different formulation than someone focused on immune support or recovery. During the infusion, monitoring helps ensure comfort and allows for adjustments if needed. Even simple things like infusion rate can impact how someone feels during the treatment. It's also important to have a conversation about goals and expectations beforehand. This helps to determine whether IV therapy is appropriate and how it should be used. When done thoughtfully and professionally, IV therapy has a strong safety profile, but it should always be treated with respect as a clinical intervention. One of the most empowering things women can understand about menopause is that there are multiple levers that we can pull to improve how we feel. No single therapy, whether it's IV therapy, supplements, or even hormone therapy, works in isolation. Nutrition is foundational. The body needs to have consistent access to protein, healthy fats, fiber, and micronutrients to support hormones, metabolism, and energy. Exercise plays a critical role not just for weight management, but for preserving muscle mass, supporting bone density, and improving mood and insulin sensitivity. Sleep is often disrupted during menopause, but it remains one of the most powerful drivers of overall health. Without adequate sleep, it becomes much harder to regulate stress, appetite, and energy. Stress care is equally important. Chronic stress can worsen many menopause symptoms and increase nutrient depletion, creating a cycle that can be difficult to break. Medical guidance can help women explore options like hormone therapy or other targeted treatments when appropriate. And then we have supportive therapies like IV therapy, which can help fill in the gaps, accelerate recovery, and provide additional support when the body is under increased demand. The key message is integration. When these elements are aligned, women tend to feel more stable, more energized, and more in control of their health during this transition. One of the things I hope women take away from conversations like this is that menopause is not a decline. It's a biological transition, and transitions require support. When we support hydration, nutrients, and recovery, we help the body adapt more smoothly to this new phase of life. Thank you so much for being here today and for prioritizing your health. I hope this conversation gave you a helpful perspective on how supportive therapies like IV nutrients may play a role in menopause wellness. Please connect with Wellness MD if you have any questions or if you're interested in IV therapy. Thanks so much.